Banking Cow's medication. So the current medication list, he's on a couple of different medication. The first one is the Tylenol, which is the brand name. Acetaminophen is the generic. The purpose for this, if he has a temperature of 100 and if he has a headache, any pain of in his lower back or knees, he should be given 650 milligrams by mouth as needed every 4 hours. The next medication he's on Novask, which is the brand name for amlodipine, and it's for hypertension. It's 10 milligram strength by mouth once a day in the morning. The third medication he's on, vitamin C, and the generic is ascorbic acid, and it's a supplement, 500 milligrams by mouth once a day in the morning. He's also on the Leosol, which is the baclofen for muscle spasms. It's 5 milligrams by mouth 3 times a day. And then he's also on the calcium carbonate with vitamin D. It's also a supplement. The strength is 600 over 400. So 600 of the calcium carbonate and 400 of the vitamin D by mouth once a day in the morning. He's also on a multivitamin with minerals, and that's the Centrum Silver that he has, the brand. And it's also a supplement. He takes 1 tablet by mouth once a day in the morning. He's also on a stool softener, Colace, but it's also the generic of, so the generic is Docicet sodium. For constipation, 100 milligrams by mouth daily, twice a day. So in the med sheet, you will have documentation of when he has bowel movements for any PRNs. He's on the doxycycline monohydrate. It's a prophylaxis because of past surgery that he has had, and he'll be on that for a while. Usually antibiotics are shorter term, but for him it's a lifetime. He's going to be on it. He's on 100 milligrams by mouth twice a day. He's also on a blood thinner, Eliquis. Apixaban is the brand name, and this prevents stroke or any blood clots that would form. And it's a 2.5 milligram by mouth twice daily tablet. He's on the finasteride, which is a generic for Proscar, for urinary retention. The strength is 5 milligrams by mouth once daily in the morning. He's also on a laxative, on a suppository for constipation, 5 milligrams as needed every 4 hours. He takes Zestrol, which is the brand name for lisinopril, for hypertension, 10 milligrams by mouth once a day in the morning. He takes at night for sleep, for insomnia, melatonin, 3 milligrams by mouth once a day at bedtime. He takes Lopressor, which is the brand name for metoprolol tartrate, 25 milligrams for hypertension by mouth 3 times a day. He takes Remeron, mirtazapine for depression, 7.5 milligrams by mouth once a day at bedtime. He also takes Omeprazole, which is the generic for Prilosec for heartburn, 20 milligrams by mouth once a day in the morning. For constipation, he takes Miralax, which is a powder that you have to give in a cup, 17 grams of the powder to mix it with water by mouth once every 24 hours as needed if he doesn't have a bowel movement. He's on the probiotic Floresta for his digestion, as he's on the doxycycline which is the antibiotic that I spoke about earlier, 175 milligrams by mouth twice daily. He's also on the Crestor, and the generic is rosuvastatin calcium for hyperlipidemia, 20 milligrams by mouth once a day in the morning. So for, again, constipation, he takes a Senna laxative, and it's also called, for the brand name, Senacort, 8.6 milligram by mouth once a day in the morning. He's also on Zoloft, which is the brand name for sertraline, For depression, 25 milligrams by mouth once a day in the morning. He's also on the Flomax. The generic is tamsulosin for urinary retention, 0.4 milligrams by mouth once a day in the morning. For his insomnia, he also has trazodone, and the brand name is Dicerol, 50 milligrams by mouth once a day at bedtime. He has another supplement of vitamin D3, 2,000 units by mouth once a day in the morning. For itchiness, dry skin, eczema, he has the Cerner lotion, and that is a 0.5-0.5%. And you apply it topically to the arms, the legs, and the thighs 3 times a day. He also has Vaseline jelly for dry skin and rash prevention. You apply a very thin layer topically to both buttocks once a day in the evening. His diet is a consistent carbohydrate diet. But remember, the texture that we spoke about was mechanical soft with nectar thick liquids. This is for dysphagia. He has trouble swallowing, so it's always obviously by mouth, all meals and drinks. We check, because he's a diabetic, we have to check, provide diabetic foot care, and check his skin for breakdown or ulcers, and report it to the PCP. He has finger stick blood glucose monitoring, because he has type 2 diabetes, via finger stick when showing any signs of hyperglycemia or hypoglycemia, and we'll talk about those signs later, to look for and to report. He has a glucose 15 gel, and the dosage is 40%. It's by mouth every 15 minutes as needed. He has to wear a contracture brace on his right knee once a day at bedtime. All his pills have to be crushed unless otherwise contraindicated. And this is for the dysphagia. He has trouble swallowing. We're checking his weight and monitoring it once a week. Bowel monitoring is every shift. So every time he has a bowel movement, you have to document. So every end of the shift, we should know whether he had one or he didn't have one. So we can know whether we could give him the PRN's medication, or we have to notify the doctor. He may not have any alcoholic beverages. And that is it for medication.